We want to work together to deliver the highest quality care, to support our communities to live well, to stay independent and enjoy life. We want to provide the very best services for our populations, and keep them at home wherever possible, enjoy life. And we know that we can't do that if we just can't do it in other ways we've been doing the same now, for lots of different reasons, whether that be workforce reasons, financial reasons, etc. And we also know that no individual organisation can do that on their own. And the way to give patients the best service is to actually work together much closer than we have been doing in the past.
It makes sense that we work together as partners across the health and social care system so that people, when they need access to either health or social care, know that they're going to get a joined up service. At the moment, it feels like there's very much a focus on treating ill health rather than helping people maintain their independence, preventing people actually needing to go into hospital in the first place. Of course, people do need to go into hospital, and if you're in hospital and you're ready to come home, what we need to make sure we've got services that are available for you. But actually what the Better Health, Better Care, Better Value plan does is it's trying to go further than that, because we're focusing on some of the more preventative work. So what we'd like to try and be able to do is to help people manage long-term conditions at home, but also it's around identifying things much earlier to prevent people becoming ill in the first place, and there's a lot of work that we can do around that. It really does make sense for us to work together. That doesn't mean that there's not going to be challenges, and it doesn't mean that we're not going to have some really robust conversations between council and health partners, but what we really do need to do is commit to working closer together so that we can provide the best level of health service and social care service to local residents.
At the core of our work is helping people to live healthier and happier lives. We can all make small changes to our lifestyle choices which can prevent a whole host of issues from arising which disrupt us from enjoying our life later. We know that enjoying good well-being increases people's sense of happiness and their ability to cope with life's challenges. So we are wanting to make 2019 the year of wellbeing across Coventry and Warwickshire.
Our health and wellbeing boards across Coventry and Warwickshire are working together to give people the advice and care they need when they need it. As partners in promoting health and wellbeing, we'll use the 2019 year of wellbeing to promote our services and the activities and information available across Coventry and Warwickshire for all our residents.
This is a positive challenge to all of us to look at how we live our lives and to make a small or big change to improve the way we feel and live in our lives for ourselves and others.
As we all know, the demands for people coming to general practice are getting more and more, and people sometimes feel frustrated that they can't get to see their doctor as quickly or as easily as they'd like. So we're really trying to think of new ways that we can engage people more so that they can get to see the doctor or the health professional they need at the right time for them. One thing that we know is really important is about people staying well, and so we talk about well-being. So that's people's emotions, people's physical health, and just people's general social conditions and how they live. And we're working as doctors, but also with other agencies, a lot of voluntary agencies, to try and give people ways to be independent and to think about stopping smoking, increasing their exercise, having a healthy diet, because all these things we know are good for you, but it's sometimes difficult to do on your own, so there is help out there. As well as that, in general practice, we see a lot of people who are really struggling with their emotions, who are feeling quite low and down, and sometimes that is a medical problem, and then the doctor does need to treat that, but sometimes it's perhaps more because of their housing or bad things that are happening in their lives. And then there are other agencies that can help, can lend a listening ear, can offer support and tell people how to get financial help and things that really the GP doesn't know much about. And so it's not about the doctor wanting not to see patients, it's about getting people seen in the right place by professionals and volunteers who can really help them. And so that's something that across Coventry and Warwickshire we're really working on, and you might hear it called social prescribing. So it's about using your local community and the things that are available in your local area to give you the support you need to be well, to stay at home and to live an active, healthy life.
We've got a very ambitious vision in Coventry and Warwickshire, which is predicated on becoming the healthiest community in the United Kingdom. That will be enabled by putting in a modern technology infrastructure, a platform from which we can start to realise the tangible benefits of technology to enable citizens and patients to be empowered with the use of information and data, and will help them to improve their lives, as well as to help all of those caregivers, be that somebody in primary care, be it a social worker, be it a midwife, be it a community nurse or a hospital specialist, to be able to give them the highest quality care whenever is convenient for them, at a time that is convenient for them. A single record enables all of that high quality information to be available when it's required at a time of need, and will enable us to deliver safer, high quality, but more importantly, sustainable care for future generations.
We're facing an ever-increasing demographic change where we have more elderly people living longer in the community, and we really need to adapt our healthcare system to accommodate this. At the same time, there's a lot of improvements in what we can do in terms of acute and emergency care, where we can actually improve outcomes for patients. So in order to deliver care and to accommodate these new treatments, we've got to look at our services to make sure that we can provide care in the right place at the right time. Now that may involve the hospitals working together to produce the very best possible care. It may also involve in thinking what we can provide in the community to keep people at home for longer, and indeed work on prevention, because the best thing of all is if we can actually intervene very early and people can help themselves to have healthier lifestyles and prevent disease.
Healthwatch is really pleased to be involved in this exciting new initiative. I think we all want to see better services for everybody across Warwickshire, regardless of where you live. It's a good thing to be working with our local NHS partners and our local social care partners to try and make sure some of those things are achieved. Some of it's about integration, some of it's about quality, all of it's about working together, and we're pleased to be part of that. A really important part of our role at Healthwatch is to champion the voices of patients and the public, to make sure that your voices are properly heard and taken into account, and that when you get the care that you get from our health and social care services, you can see the difference that your voice has made. And we will be the champions for ensuring that that happens.
Most of our members across both Coventry and Warwickshire are involved in helping health and social care, or health and well-being in the widest sense. But many of those organisations and groups won't necessarily be working hand in hand with the strategic or the operational health and social care system across Coventry and Warwickshire.
So a lot of the work that BAC and CARVA do together is around bringing people who've got solutions to social problems alongside their medical colleagues, so that actually some of these problems can be solved in a different way.
We've got examples across Warwickshire now where we've got social prescribing working at different speeds in different areas, targeted at different issues, and it is bringing some of that capacity to work very, very closely together, and it's releasing capacity within the traditional health and social care system.
And likewise, when people leave hospital, actually being supported at home is one of the most key things for people not returning to hospital, and that's where integration between health and social care comes.
I think the future, whilst in many ways is going to be challenging, we know why it's going to be challenging, they say the same with the rest of the NHS. Actually, the work that we're already doing with all those partners, I think we could see some real fantastic change in Coventry and Warwickshire, which will be leading edge, but importantly put us patients at the centre of everything we do and every decision we make, and that's going to be different.